From our 22 News Broadcast Center, this is 22 News in Focus.
Good Sunday afternoon. Welcome to 22 News in Focus. I'm Kate Walsh. It takes a village. We've heard that phrase so many times and in so many situations, and it applies perfectly to what we're discussing for this week's In Focus. For the past year or so, an historic neighborhood in Springfield has been getting some national attention and help in improving the well-being of people who live there. It's called the Healthy Hill Initiative, and it's truly a collaboration among so many local and national partners. Many of those people are represented here in our panel discussion today. So joining me is the man behind this initiative nationally, Ed Hunter. He's the president and CEO of the De Beaumont Foundation, which we will be discussing first. And then leading the initiative locally is Sarah Page, Senior Vice President of Community Building and Engagement for HAP Housing. Bay State Health and Mercy Medical Center are also partners in this program. Anna Marie Golden is from Bay State Public Health and Community and Government Relations. And then from Mercy is Executive Director of Community Benefit and Health, Doreen Fadis. Also from the Old Hill Neighborhood Council in Springfield is its Vice President and longtime resident, Awilda Sanchez. So thank you all so much for being here. It's a really interesting topic that not many people, I bet, in Western Massachusetts know about just yet, but I'm sure they will very soon. So we're hoping to educate people on that. So before we get into the specifics of how it all works in Springfield, tell us about the foundation and some background on what the mission of De Beaumont Foundation is.
Great, thank you, Kate. Really happy to be here and also to be representing, sitting in, I suppose, for the 5 national funders of the Build Health Challenge. De Beaumont is one of them, and the administrative and institutional home of the challenge. De Beaumont is actually a foundation that has its roots here in Western Massachusetts. Our founder, or our donor, was Pete De Beaumont, who founded the Brookstone Company. And we've evolved a focus that's really uniquely focused on public health, which is the agencies and staff who really work across from the government public health agencies to improve the health of communities, not only to protect people from outbreaks and disease, but also to improve conditions and try to deal with the issues that affect health. And that's where the Build Health Challenge is such an important part of what we do.
And Build Health began the same year you became CEO, right?
One of my first pleasures moving from the Centers for Disease Control and Prevention to De Beaumont was to sit in on the review panel the very first time. We had almost 300 applicants for the challenge, and sitting with our funding partners and technical advisors to sort through some really excellent proposals. And we were pleased then with the energy that communities were showing and coming together around these big broad health issues, and we're really happy now to see how it's playing out in the field.
What was the reasoning for creating this whole initiative in the first place?
Well, it's twofold. One is the challenges that communities are facing, or that we're all facing, are not just about getting medical care, not just about getting treated for a condition that you've already developed perhaps over 10, 20, 30 years. But dealing with the underlying social factors, social, economic, health factors that really contribute to what eventually becomes a treatable condition. So clearly we need excellent treatment from our partners on my left side, but we also need to deal with the factors that are creating the conditions that make people healthy or not, and what kind of choices they have, what their communities look like. So one major objective was to really try to intervene at upstream. Public health really tries to deal as far upstream in that pathway. Instead of waiting until conditions kind of roll down, what can you do? And that really has to focus on these kind of social, economic, community conditions. The other thing that led us to working with Kresge Foundation, the Advisory Board Company, Robert Wood Johnson Foundation, the Colorado Health Foundation, and De Beaumont was, how do we establish partnerships? Because these are problems that are big enough and intractable enough that you can't just go at them either at a community level or at a national level in isolation. We kind of tend to evolve programs and initiatives that are, you tackle this problem or this specific thing or this specific set of individuals, and you really need to kind of work together. So we started at the funder level to try to find a way to collaborate across what are multiple perspectives and initiatives. De Beaumont being very focused on public health, the advisory board company being consulting with hospital systems, Kresge, Robert Wood Johnson, others dealing with real community-based organizations, and Colorado with a real reservoir of engagement in the community in Colorado. So how do we take what we tried to do at the national level and try to replicate partnerships across health systems, public health agencies, community organizations to really try to pull all that together? From that came the Build Health Challenge.
Wow. And how did you get the word out about it to these local communities across the country?
Well, starting with the 5 funding partners, we all had networks, and I think community organizations will tell you there's a lot of ways that you can watch what grant makers are announcing, but we made a real push to try to get this down through these 3 different networks, through the hospital systems, to public health agencies, and to community organizations, and somehow the word got out, because we got, I'm sure behind the 300 or so proposals we got must have been hundreds of others that tried it and didn't quite get the momentum that communities like Springfield had to propose. And
I find that, I've been researching this whole initiative for a little bit, and I found that one of the key words that kept coming up is collaboration. It really is a collaboration among the hospitals, local groups, HAP housing in this case. So Sarah, you were really behind getting this ball rolling for Springfield. What made you want to sign up for this? How did you find it?
Well, the background that we thought we would share is that Peter Gagliardi, who's the executive director of HAP Housing, invited Doreen and Frank Robinson from Bay State Health to a conference in Washington, D.C. to talk about the intersection between health and housing and community development. And that was sponsored by NeighborWorks America, one of the organizations we're a part of. And so they came back all enthusiastic about working on this together. And soon after that, the Build Health Challenge was announced, and we heard about it from lots of our different networks. And so we just said, wow, we have to apply for this. We are a great collaboration. We already are connected with each other. And so Partners for a Healthier Community is one of our other key lead organizations. And so HAP Housing and Partners went back and forth, which one of us should apply? And so we both are co-leads, and we decided ultimately for HAP Housing to apply because we've had a long history working deeply in this neighborhood, and that was one of the criteria of the Build Health Challenge.
Interesting. And the hospitals are obviously involved in this as well because it's about public health. So can you talk briefly about your roles in this whole initiative? And we'll get into the details later about all the health concerns and stuff in that neighborhood, but just a general sense right now. How would you?
Well, initially just after the meeting in Washington was just, how to put this together and what can we bring to the table, what things can we do, and just, participating in meetings. First of all, the hospitals have worked together on community health needs assessment now for over 3 or 4 years together and forming coalitions, so the relationship was already there. And how do we now focus it into this old hill? And Anna Marie, I don't know.
Sure. So for Bay State, 25% of the residents that live in Old Hill actually receive healthcare services at one of our 4 community-based health centers. And so we were able to look at our own patient data, inpatient, outpatient, emergency room discharge data, and offer that to this project and analyze that data and provide mapping to help paint a true picture of what is going on in the neighborhood. And we're hoping to continue that partnership so that we can look at that data annually to see how we're moving the needle over the next 5 years.
Excellent. And there were some strict criteria in people applying for this. I have all of your application letters in this binder in front of us. We're going to get into that and the acronym that BUILD represents in just a second, but first we're going to take a quick break. You're watching 22 News in Focus. Welcome back to 22 News in Focus. Today we're talking about the Healthy Hill Initiative, a neighborhood improvement project funded by the De Beaumont Foundation that focuses on health, safety, and economic conditions within a community, specifically a neighborhood in Springfield. They're one of 17 communities that have become part of this Build Health Initiative. So that's saying something about Springfield. There were 300 something that applied. there are strict criteria to be able to get this funding. So can you describe the acronym that BUILD stands for?
Every community that applied was asked to respond to what became the BUILD is stands for. So they all had to respond to each of the 5 letters of BUILD, and they kind of represent what we think it's all about. The B is for bold. May speak for itself. So we want really, bold, action-oriented proposals and communities that are really poised, ready to take action on things that really will have an impact. Upstream, I mentioned earlier, is really trying to tackle problems in the community before they become before the health consequences from them come, and then you're kind of on a path where you need treatment and have a lot of consequences and cost. Bold, upstream, integrated is, I think, why we're all sitting together. It really is that partnership model where the proposers had to have a healthcare partner, had to have a strong partnership with the public health agency, and they have that, in fact, with Springfield, and have to have a nonprofit sort of host and convener that also has capacity and talent. The L is local, so we really wanted not this broad national focus or even statewide or citywide, but we really wanted to hone in on problems that were definable and recognizable in very specific communities. So the Old Hill neighborhood, fortunately, had enough data to document what its issues were and be able to start the process to build out the understanding of how those might be addressed. And then data-driven is sort of the why you want local, and I think that knowing from Bay State where the patients are coming from, what the conditions are that they're bringing into the healthcare system, and then that allows you to back up and kind of go upstream and see where the problems are arising. But we really want to focus on how you can get data that crosses over from these little compartments or silos, we call them, where public health has data, healthcare systems have data, the community obviously understands how they're experiencing these issues, and many nonprofits have data about service delivery or things that they see in the community. But you put those together and you create something that actually really can lead to that action that we're after here.
And as someone who lives in the community for over 20 years, can you describe why Old Hill is a perfect candidate for this program and has been for the past year?
I think that one of the things that we had in our favor is that our neighborhood council had already prepared a 5-year plan on things that we wanted to see in our community.
And you had projects and things that were going on in the community before 1 year ago, right? So this was just the perfect kind of transition to get some more funding?
In a way, yes.
Excellent. And so as we're talking about data, that's huge, but you also have to be careful because of HIPAA laws and everything else with that. So how do you keep track of the data and then make sure that it represents that community? And you, like you said, 25% of Old Hill residents go through Bay State. How do you keep track of that, and how do you share it among different organizations?
Well, we de-identify it so that there's no patient identification with it. We are able, based on information that's collected from our patients, and also Health New England as well is one of our, we own Health New England, so we also have data from them. We're able to look at it more closely and learn where residents are coming from, and based on their diagnosis and primary diagnosis and other diagnoses, able to determine health issues that are specific to those neighborhoods and those residents.
And so you can categorize it by where people live? I didn't know that, so that's interesting. Mercy does that as well?
Yes, yes.
Excellent. Okay, so how much is this initiative now it's been almost a year, right? If not exactly a year. So how much is this initiative for, and how have you used that money so far?
So each of the planning communities, and Springfield is one, starts with a small grant to collect the data, to get the partnership lined up, to develop plans, and then has the opportunity to apply for a second year of funding for the implementation of the plans that they have developed. And so other communities that were maybe a little further ahead in their data development or in their planning might have started out. There are 7 of the 18 that started out with implementation awards. And they'll continue for a second year. So where Springfield is in this process, like the other planning grants, is this summer, and it is about the 1-year anniversary when we awarded these. Springfield is applying for that next step. And unlike the first round where it was highly competitive and you're vying against other communities, this is sort of the pass-fail model where if you've met the criteria that were in the first grant, we actually have a process to evaluate the proposal, and within, I think, weeks we'll probably have an answer on the next step for Springfield.
And so how have you met the criteria in the first year so far? What does the last year look like since you were awarded this grant?
We've done an incredible analysis of the health conditions in the neighborhood and looked at a lot of other factors through our data. And then we had a number of community meetings. We interviewed residents. We really worked with the neighborhood council closely. So we had a real sense of what the people in the neighborhood felt were the problems. And we, at one point, took data to them. We had analyzed the data, and then we had a community meeting and said, here's what we learned about the children in the schools and their obesity rate and different things, and got amazing feedback from the neighborhood based on what we were telling them. They said, oh yes, we agree, we understand that problem, and here's how we understand it. So based on all of that, we came up with an implementation plan, and we've sent our implementation plan to the de Beaumont Foundation, and we're very excited about it and feel that we've had a really amazing year working together on this.
Yeah, and can you describe how it's been in the community, maybe what some of the biggest concerns are, and if people are starting to talk about it since this has become, a program in the past year?
Can you say something about that, Ms. Aaron?
Sure. Well, you've been really coming to the public meetings and helping get people there, and you agreed that even people on your street had amazing comments about how the tornado had affected health and how other issues had affected health. And I think you and I both agree that there are lots of people ready to help us with this implementation plan.
Excellent. And after the break, we're going to talk about all of the biggest issues in the Old Hill neighborhood: health concerns, the tornado, housing issues. So we're going to take a break and we'll be right back. You're watching 22 News in Focus. You're watching 22 News in Focus. Today we're talking about the Healthy Hill initiative in Springfield. It's an amazing plan to improve the living conditions for residents in Springfield's Old Hill neighborhood. So we're going to speak with a resident now who has lived there for some 20 years. Describe to people at home what it's like to live in that neighborhood.
Well, I am very, I guess I'm very pleased to live in that neighborhood. I have raised 3 children there, and I have 9 grandkids that have also been raised in the neighborhood, and I find that it is a very, we have a very friendly community. I find that one of the nice things about living there is that I've known my neighbors, and they know their children, and our children have grown together, and we've worked on different projects like gardening. We worked in
Like
what else have we done?
Gardening in the community?
Yeah, gardening in the community has been a great source for our community because we live in a place that we don't have supermarkets nearby, and that's I guess we're considered a food desert area. And we pretty much, if it would take an amazing trip to go to a supermarket, if you don't have transportation, you would have to take the bus, and that would mean you bring less groceries, or you would have to use the little stores that are around the bodegas and the other convenience stores that usually do not sell any fresh, healthy foods in general.
So that must affect people's health in the area, especially people who rely on buses. They only run certain times. Like you said, they probably have to just carry what they can. They don't have a car that they can fill with groceries. So how do you get around doing that? Is it difficult each week?
Well, I have,
You have a
I
card.
work with Gardening in the Community, and they're amazing because they have a food program where you can buy a share and they will bring it to your home, or you can pick it up once a week during the summer months. And we get a different variety of fresh fruits and vegetables. We are also encouraged through them and through their programs to grow our own gardens. And I had started a community garden in one of the vacant lots in our community. It wasn't just me, it was a number of us got together and decided that we were going to start a vacant lot committee. And what that meant was that any vacant lot in the community wanted to clean it, green it, and add wildflowers. And if residents were interested, they were able to use it to build community gardens, because that's another way of addressing the issues of food deserts.
Yeah, and probably helping the community come together at the same time, right?
At the same time, because these are great intergenerational projects, and a lot of the youth are, Gardening in the Community works with a lot of youth to build leadership skills and also to teach them. I was surprised that kids thought that tomatoes did not come from the ground, that you just get them in supermarkets. But once you taste one that you've grown, they will know the difference.
Exactly. And Revitalize CDC, that's part of this initiative, right? A partner in that. Would you guys someone want to talk about Revitalize CDC and how it's helping the community?
Well, I just know recently they had the Green and Fit event where they focused on 2 streets in the Old Hill neighborhood, and just everything from roofing to ramps to painting to working on shrubbery and things like that. So, you know, the hospitals participated by volunteering at the event. Mercy had the first aid van. So, I mean, that's one of the ways that we can contribute way beyond the data, that, you know, we are out there and working with the community, picking up on that wonderful spirit that Will was talking about. At the neighborhood meeting that I participated in, I just thought the spirit of people in the room was just great. As much as they wanted to hear the data, they wanted to hear the statistics, everything from obesity to crime, each person raised their hand. The reason they stayed in the neighborhood was because of the people and their neighbors. And I thought that was so touching. It was really great. Yeah.
I've been to these Revitalize, you're watching video right now of one of the Revitalize CDC events, and it's so amazing to see so many people just close off a street. If you're not familiar with it, they come in, all of the supplies, this man's painting, and they just clean the entire street. They, you know, make it beautiful, help fix up the buildings and stuff. So as someone from HAP Housing, how does that all play into what you do?
Well, for 12 years, we worked with other housing organizations to take down dilapidated houses and build new houses or rehab some that were in tough shape. And then Revitalize came along and took the task that was so needed of helping people who already own houses and they hadn't been abandoned, but they needed help because some have very limited incomes, many were older and on really fixed incomes. So they've gone from street to street and have a commitment for 10 years to do a block at a time. And so they're filling in amongst the new houses, bringing the other houses up to, you know, really great shape. And it's made such a difference in a lot of people's lives.
How big of a problem is vacant housing in the Old Hill neighborhood still, though?
It's still a significant problem. We know that when the foreclosure crisis hit and so much housing across the country was struggling and abandoned, we know that things would have been much worse had we not already been really working there. But it was discouraging when we had, you know, really made a difference on streets and gotten most of the vacant properties dealt with, and then the foreclosure crisis hit, and it hit hard in Old Hill. So we still have vacant properties, but they're nothing like they were 12 years ago. 12 years ago, there were burned out houses sitting there that hadn't been dealt with, things weren't boarded, there was illegal dumping significantly around the neighborhood, and today you don't see that. Anything that is abandoned is boarded and kind of being taken care of, and the city is really collaborating with us to target what really needs to be addressed and works with the neighborhood council. Wilda mentioned the Vacant Properties Committee. The residents go and decide what the top 10 properties are that need to be addressed. And the city has made this commitment that they absolutely fulfill, that when that list comes to them, they immediately go out and clean lots. And you know, when we look at the list we sent in a year ago, everything has been addressed. Houses have been demolished that had sat there for years, and so
in a timely fashion too.
Yeah.
That was very surprising.
Yeah.
and exciting.
Often things take a lot of time once you apply for something, right? And so how did the tornado then come into play with all of this? I'm sure some houses
we lost a number of houses, and unfortunately we had a public housing area that had to be completely demolished. But one of the good things that we did get from the tornado is that we have a brand new beautiful school that we really needed. So there's been a lot of Regreen Springfield have bought in a lot of trees, because I think our community had a lot of trees. I don't know if you've ever seen old pictures of the old hill. They had the maple trees all along Walnut Street. They were beautiful big trees. I had trees in my house, fruit trees, that I lost completely to the tornado.
It is.
Yeah, one of the things that strikes me in having gone through the community and seen the tornado, we do really well as a society and in government in responding to a disaster. We don't always do very well at preventing them. What's really great about what's happening in the neighborhood now and in Springfield is people see there's a slow-moving disaster coming. You call it another slow-moving tornado, which really doesn't make a whole lot of sense, but there's a tsunami, some people call it in the public health world. There's hypertension, there's diabetes, there's obesity issues, there's huge health challenges that are the natural consequences of problems that arise from the way people live and work and interact in the community. And what's great about what the community is able to do now with the Build Health Challenge and a lot of other things going on is to try to head that off. And we don't really, we can build a school after the school we had was hit by a tornado, but here's the opportunity to head off the disaster that you can pretty well predict. We know what happens when communities have health issues like Old Hill, and we know things we can do to prevent that. But it takes this broad coalition of parties to come together, because no one party can actually stop that kind of a disaster from happening.
Do you find on the national level that it's still pretty rare for for communities like Old Hill to really come together the way they do? With, it seems, hospitals, local communities, organizations all coming together. Is that a rarity still across the country? Or
I think, it's an unfortunate reality. Governments don't collaborate well with each other. Agencies of government. I was struck in visiting Springfield, the housing department and the public health department were sitting together with the police department and a whole bunch of others. That's really quite unusual. We have these compartmentalizations, and we're all in government. I was in government for many years. You're paid to do the thing you're paid to do, and it's much more complicated to step outside and say, how do you think I should be doing my job? Because I kind of know what my job is and I'm going to do it. It's way more complicated. It takes more time, takes more compromising, but the net effect of it is far more impactful and also more sustainable once you bring in more partners and more elements. So I think what's happening here, we actually hope in the Build Health Challenge to be able to use communities like Springfield as a model for others, and we're doing a really systematic job. We're probably bothering you a lot with a lot of questions and a lot of evaluation, but we're really trying to pull out of these 18 grantees what's working, how do we replicate this somewhere else, how do we kind of do the build in the box for the next community that can pick it up and learn from what's happening here.
So when this started, were you taking a big chance, or had you seen this model work on a national scale you were talking about in the beginning and hoped that it would work on a local scale?
I think things don't work on a national scale. An old colleague of mine used to remind me, people don't get sick at the national level. They get sick somewhere where they actually live. So part of the L in Build is really to focus on getting traction somewhere that's real to real people, like your community, real partners, real health systems that have data like you've described as knowing where your patients are and sharing that information with people that can actually intervene in that upstream world. So I think there's models. We've seen things that work really well. We have project called the Practical Playbook, where we're actually trying to collect success stories. Build actually grew from our foundation's standpoint out of our desire to have much more of a learning laboratory in communities. So we partners with others to make this a reality. But I think it's too rare, and we're still trying to pull out of communities what works, so that people aren't losing time trying to get going in the next community.
Very interesting. So after the break, we're going to talk about some specific health concerns that are in this neighborhood and what the local hospitals are doing to try to work through those with the community. So we're going to take a quick break and we'll be right back. You're watching 22 News in Focus. Welcome back to 22 News in Focus. Today we're talking about the Healthy Hill Initiative, a safety, health, economic improvement project in the Old Hill neighborhood of Springfield. We were just talking about some of the devastation from the tornado in that neighborhood. Now we're going to talk about the specific health problems that have led into this initiative being useful for this neighborhood. So I'm just looking at some of the statistics here that your organization gave to us. And asthma. In Old Hill, 20% of students have asthma compared to 11% of students in Massachusetts with asthma. That's a pretty high statistic there. We're also looking at obesity levels. 1 in 3 adults in Old Hill are obese, where 1 in 4 in Massachusetts are. Some of the other concerns, mental health concerns. It says mental health hospitalizations per 100,000 people, 2 times higher in Old Hill than in the state of Massachusetts, and that includes depression and anxiety. So ADHD we're looking at here. Numerous health concerns. So how are the hospital systems in Western Massachusetts, in the Springfield area, helping with this and preventing this from being a growing concern in the future?
So with the change in the healthcare system, with the Affordable Care Act, hospitals now are incentivized, it's in our best interest to take care of our community and make sure that they're healthy and don't come to us when they're really sick. So that's what's great about this Build initiative, is that we get to do that, we get to be a partner, and we get to help look at what of those upstream interventions are to help prevent our community members and our patients from coming to us in the first place. And so you're seeing hospitals really show up differently now in the community versus just seeing them in the doctor's office. You know, we're going to see more community health workers and integrated behavioral health and home visits and such. So, and we're taking an active role in advocating for full-line grocery store and bringing fresh fruits and healthy vegetables, and advocating for good housing for all of our patients as well. So we're definitely showing up differently than we have in the past, and that's clearly been shown through the work that Mercy's doing with the Trinity Health Grant, and Bay State is also investing some funding in the community as well.
Can you talk about the Trinity Health Grant? I'm not familiar with that.
So at the same time that the Build grant came along, Trinity Health, which Mercy is a part of, which is the 4th largest healthcare system in the nation, they put out a grant proposal. And Springfield was one of 6 grantees, and we got a 5-year funding cycle to look at the health of the community. So we're a little broader. We're looking at the north end, the south end, and Mason Square, but Old Hill is in that. And specifically looking at smoking cessation, healthy lifestyle, obesity issues, safe streets. The Food Policy Council is a part of it, looking at the programs in the schools, and just in general evaluation of the program. So Build Health and the Trinity Community Transforming Initiatives, TCI we call it, they're very much in sync and moving towards the same thing. So it's wonderful to have these 2 initiatives working at the same time.
And together, I'm assuming.
And together, so that gives our 6 partners, Martin Luther King Center, Family Services, HAP Housing, Partners for a Healthier Community, Pioneer Valley Planning Commission, Square One, and I'm missing one, Sarah. Who am I missing? Food Policy Council. Their hands, boots to the ground on working on this, and the money comes through Trinity. So the initiatives of the hospitals, the initiative of the Build, it's just all focusing on one thing, better health.
Excellent. And let's talk, you have a background at the CDC, and obviously you're knowledgeable in health, public health. Why are these issues in relatively, poor areas, maybe like Old Hill, why are we seeing these higher rates than they are in the statewide levels?
Well, I think the food example that we talked about before it's a clustering of effects. So there's the absence of, you could start with safety. There's the absence of, if there's perception or reality that the community is unsafe, it's tough to send your kid to the park. It's tough to go for a walk on the street. It's tough to send your kid walking to school. If it's hard to get groceries, it's hard to eat the right foods. Or if there's not a economically viable place for you to get quality foods, you might be eating less quality foods because you have a constrained budget. Access to primary care, access to mental health services are usually more challenging in poor communities than they are in other communities. Just income, I think the literature is well beyond question that income and education and opportunity have a huge impact on health. So it's the clustering of these things in communities where it's not any one of those things, but the stress that comes with that, the lack of opportunity and jobs and economic vitality, I think it just kind of weighs on these communities in addition to any one of these specific things. So that's why tackling the cluster of them is so important. And as you started, it takes a village, but it takes the good policing, it takes good food access, it takes a transportation system that allows employment, it takes a jobs program, it takes quality housing, it takes the ability to identify where within the housing stock there may be a problem that's breeding the asthma cases. But I think it starts with income, education, kind of basic socioeconomic variables that are really beyond question in public health literature and research. And they all add and they weigh. And so that's why you can't tackle one of them at a time, because the other one, it's like water. It will just cover back over the space that it created by solving one problem.
So as you were saying, one of the biggest ways I'm sure that this can try to stop this trend for the future would be education and going out and researching what the problems are and how to fix them, right? And that's what you're doing with these grants, I'm assuming, in the past year, gathering that information and seeing where you are to make a difference in the future. Excellent. And have you noticed these problems living there? It's easy to look at this data, but day to day?
No, definitely. We, like many communities in Springfield, we had a lot high crime area, gangs and drugs. But I can tell you that in the last couple of years, and I think a lot has to do with the 3C initiative, with this our community policing. They are, by the way, we have the best community policing in the area, but they have helped make, they have a presence in the community and they have relationships with, their primary goal was to build healthy relationships with the residents. And also there is more reporting of things that go on. They've helped in many ways to bring a police presence, but also talk to the residents. We're building relationship. It's not just about enforcing. So you can see the difference in the community. It's a little bit safer because, again, I am one that I love going for walks, but if you're not safe, it's just not an option. But we are hoping that changes with this Health Build initiative.
Yeah, and I think Old Hill has 3 parks. There's so many opportunities to go outside and enjoy it, so it's a shame that people might be afraid to do so, but it seems like that's starting to change.
Definitely.
And that's all leading up to why Springfield and Old Hill was a candidate and got this initiative in the first place, right? Showing the...
They had some traction, and they had aspirations, they had plans, they had already brought people together. I loved what you said earlier about, I think it was community gardens. To me, I'm going to steal this and use this as the new catchphrase for Build. A couple people got together and did something. That's the essence of what's happening here. It's a couple people, a couple of organizations, and then it kind of grows, and you get momentum. You show you can do something, and you move on to the next thing. When the Build Health Challenge grant is done, hopefully that kind of a mentality and partnership with also some help from the Trinity project and other housing initiatives that are in the pipeline, I think the traction is there, and that it has to start somewhere, and it's a couple people deciding, let's get something together.
All right, we'll be right back. You're watching 22 News in Focus. You're watching 22 News in Focus. We've been talking about the Healthy Hill Initiative. It's part of a larger program called Build Health across the nation. So in the first year of this program, which this just reached its first anniversary, it's been all about planning, and that's what the grant was for. But in the future, there could be some implementation, and that's what you're hoping for, right? It's the second phase. So first, talk about the differences between the planning and implementation phase, and then what your hopes are.
Sure. I think in the communities that went for the planning option, they've done exactly what they needed to do, which is to start to build the collective data resources, start to really convene the community around what they see the problems as being. And then there's this inevitable honing of what it is that really is the thing you have to do, because we're not talking about hundreds of millions of dollars. We're talking about definable, actionable plans. And so we're now at the point where the Springfield group has sent to our collection of funders their proposal for what exactly those things are, and I'll let Sarah talk to those. But we're in the process of evaluating those, and as I mentioned, in this pass-fail mode. And our approach all along has been, we're not trying to turn people down. We're not trying to find failure. We've actually provided a lot of technical assistance, maybe more than you've asked for sometimes, but a lot of support to try to move forward to implementation. So we're really anxious to see a success, and I think that really requires the community to hone in on what exactly it needs to focus on.
And right before we get to Sarah, can you talk about the actual money, the value, the monetary value of
the next phase would be $100,000 from the 5 funders, the national funders, matched with resources from the community. So it's and then I think the bigger issue is, outside of the immediate dollars, in a sense, that are associated with the grant itself, are these other ancillary kind of things. And the policing, as an example, is really key to making anything in the physical activity initiatives work. But it's not something paid for by the grant. So it's all, how do you keep the community moving together on addressing these?
Okay, and now let's talk about what your goals are for this new plan, hoping that you actually get it.
Well, as we were talking about, we looked at so many things. So our group had to really figure out, of all these things and all that the community has told us, what should we focus on? And we've decided to focus on physical activity, because we heard over and over that people didn't feel that they were getting enough exercise, they weren't getting out on the street, partially because of public safety. And the police officers were telling us, we want to be out with the community, we want to be really engaging with them, because that's how they hear where crime is happening and how they get the information they need to really deal with violent crime. So, so we have this plan to have walking groups, and Awilda wants to lead one of them, and we know other people who really want this. So we're going to have people walking around the neighborhood, getting exercise, and looking at where a vacant lot needs to be cleaned, and giving information to the police, and the police want to walk with people. So we think that's going to make a really big difference. And then the other piece is having youth programming, having more that's happening for youth out of school, maybe weekends, evenings. Certainly gang recruitment is an issue, and so the idea is to work with 4th to 8th graders, putting really positive, exciting things happening, and the police also want to be engaged with that in helping have positive role models for the youth. So we're going to be just starting a whole lot of really interesting programs in the neighborhood, and think it's going to make a big difference.
Awesome. And so how do you plan on having these walking groups? Do you already have, you've lived there for so long, you must have friends and neighbors that are all willing to do this?
we've invited people to want to be coaches and walk with their neighbors and see in what areas we can improve in the neighborhood. And we're also looking at having bike paths. I mean, our neighborhood doesn't have any type of bike paths. And so, and making our parks also maybe places where we can also exercise with our kids. And not only it being a playground, but also being functional as a exercise. I mean, how many people really have money to go join a gym?
Right.
So.
That's awesome. And you think it will really work?
Oh, I think it would really work. I know for my street at least, we're ready.
How big of a neighborhood for people at home is Old Hill? Talking street-wise, you know, you don't have to give a certain number, but 20 blocks, would you?
A little bit more than that, I think. I think we're really big.
4,300 people. I haven't actually counted the blocks.
Oh, we have a map of where Old Hill is
Right.
in relation to all the other neighborhoods of Springfield, and it's part of Mason Square as a bigger neighborhood. So that gives
definitely.
people a general idea as to how big it is and where it is.
Yeah, maybe 40 blocks.
Okay.
Maybe 40.
Yeah.
I would
Okay, so a lot of walking, a lot of exercise there.
Yeah.
And on top of that, that will also have trickle-down effects for preventative care as far as, you know, asthma and education and all that stuff, people getting exercise, right? And so how will you guys have a role and what are your hopes for the future of this initiative?
I mean, what role can the hospital play in this? I mean, the community can tell us, can we be on the walks? Can we be at the end of the walk with, you know, an education piece? You know, our job is not to make only sick people well. Our job is to keep well people from becoming sick. So that will be the whole part of it. And, you know, what the needs are in education and being partners. And with the Trinity Grant, we have a chance to put some capital dollars in. So can we help with getting the bike path in, the loan dollars or the playground and things like that? So, you know, what part can we play as this develops and grows in the implementation process? Definitely.
And you ladies, during the break, were talking about how you've kind of noticed a transition in the way the hospital attitude is, right?
Definitely.
Yeah, absolutely. I think the hospitals, we are anchor institutions in our communities. We're here, we're not going anywhere. We drive economic health in the region. And so how can we continue to show up as a good neighbor? And so we're doing that through this process, and there's many, many more opportunities for us to do that. And as we continue to think about how we want to invest our limited resources, we want to do it in a very strategic way so that we can show impact. And so this example of Build Health is a perfect pilot for us to do and to go back and show our organizations and our leadership of how we can really start to improve health at the neighborhood, at the street level.
And have you found, just really quickly, have you found that this Old Hill first year of this program compares to other programs across the country that have also been part of this initiative?
Yeah, I think that, and one of the things we've tried to do is put the communities together on calls, and we had a conference last week where many of the communities came together and they're exchanging their experiences and learning and how do you solve the data problems and what do you do with when you have too much and you have to hone in. And I think in some ways the groups have moved together, you know, tag teaming or leapfrogging and learning from each other, and I think that's been really helpful.
This is a really interesting conversation. Thank you all so much for being here. We're going to take a break and we'll have the last word right afterwards. You're watching 22 News in Focus. You've been watching 22 News in Focus. Today we've been talking about the Healthy Hill Initiative, a program to improve the living conditions of residents living in the Old Hill neighborhood of Springfield. The program is part of the de Beaumont Foundation's Build Health Challenge, which has provided an award of $75,000 to fund the first year's worth of planning, and they hope there's many more years of implementation after that. So that's our program for today. We want to thank our guests for joining us, and thanks to you at home for watching. If you missed any of it, you can watch it in full on our website at any time at wwlp.com. And from all of us here at 22 News, we wish you a wonderful Sunday.